Welcome to our series called Obesity Care with Dr. Kanica Yashi. Obesity is becoming a serious threat to us in the growing years. Obesity is now a burning issue and a major health crisis. And if not addressed soon, we will witness many succumb to this deadly disease. Our today's topic is role of diet and nutrition in obesity care. So let's talk to a subject matter expert, Dr. Kanica Yashi. Dr. Kanica Yashi is trained in internal medicine and obesity medicine and is American board certified in both specialties. She currently practices at Cooperstown, New York, and is a hospitalist and as well practices obesity medicine. She's a skilled educator and researcher involved with multiple studies as well. And she holds important leadership positions with the Obesity Medicine Association and the New York chapter of the American College of Physicians. She also serves as an associate editor for the journal Obesity Pillars. Dr. Yashi is passionate about her practice of obesity medicine and her hobby of cooking, and in the process of combining the two by making a page for wholesome Asian meals, especially keeping in mind the nutrients and calories. So welcome our subject matter expert. Dr. Yashi, welcome to our show. How are you doing today?
Hi, Sharad. Thank you. I'm doing really well and very excited to be here today.
Wonderful, Dr. Yashi. I'm as well excited to talk to you more about today's topic. And so let me kick off with today's question. Our MANATVINT international audience are curious to know. Tell us, why is diet so important in regards to losing weight?
Yeah, so diet is something that's really important because your weight is actually determined 80% by what you eat. So 80% of your weight is actually your diet and about 20% is your physical activity. So physical activity is very important, but you can never really outrun your meals. So therefore, it is very important to know what you're eating and how much you're eating. So that is why it's important to talk about the diet.
Thank you for that answer, Dr. Yashi. So let me proceed to the next question. Is there a specific diet that people can follow to lose weight, and give us the tips and tricks for that?
That's a very interesting question, Sharad, because I know that there are so many diets that are out there that people get confused about. But I really want to emphasize that that in the end, it comes down to the number of calories that you're consuming in a day. So no matter what diet you follow, it really is calories in versus the calories out. And we know that if you are trying to lose weight, you have to try to keep a 500 calorie deficit in a day. They say that a moderately active man needs about 2,000 to 2,200 calories in a day to maintain their current weight. And a female who's moderately active needs about 1,800 to 2,000 calories in a day to maintain their current weight. But I know that there are a lot of apps out there with which you can calculate the exact number of calories that you need to maintain your current weight, because we need to know how many calories you need to maintain your current weight before you can start moving towards that deficit. The apps basically look at your height, your age, your weight, and your exercise levels, how active you are, and so forth. And once you know that number, that these are the number of calories I'm consuming in a day, then you can start moving towards maintaining that deficit. They say that people who can really calorie count, that is jot down the things that they are eating and the calories associated with that, they are more successful in losing weight. For example, there are a lot of free apps that are available like MyFitnessPal and so forth that people can download and jot down the calories they eat during the breakfast. For example, if you're having a toast or an egg, you can just simply put that down. Then if you're having a sandwich for a lunch, you can put that down, and then snacks. So you know you are eating those many calories, and now you are more aware. So going forward, you can be more cognizant and then take steps towards maintaining that calorie deficit. So again, to come back to that question, I think it's, again, the calories in versus the calories out. It's total number of calories that you're eating, whether you're getting that from a Mediterranean diet, a keto diet, or intermittent fasting, or with just your regular food. So it's that number.
Okay. So actually, so it is pretty much the math, like how many calories you're consuming versus how much you're burning them. And, I mean, it's pretty much pure mathematics. So you know what, so you'll know how to keep account of what you're consuming and things. So you got to be pretty proactive in that regard.
100%. And I mean, on that note, we know that, and because of the data, 80% of Americans underestimate how much they eat. So people think that they are only eating, for example, 1,500 calories, but actually if I sit down with them and start jotting down everything, it's going to go over 2,000 calories. And this is just the American data, but I'm pretty sure that's the case in the rest of the world as well. So knowing that, having that knowledge of how much you are eating, how many calories you're consuming is so important to know before you start taking steps to reduce what you're eating.
So thank you, Dr. Yashi, for clarifying, that question, answering that question beautifully. And you mentioned about keto diet, intermittent fasting, and I also heard about, yo-yo dieting and things like that. So we have all these kind of different varied diets in the market per se. So what do you think about these, and do they really work? As a obesity specialist, what is your take on that? What do you advise our MANATVINT international audience?
Sure, I think there is a lot of mixed data on these diets. There is one sect of people who really believe in these diets, and then there are these others who do not.
Mm-hmm.
From what I have read, I feel it's mixed evidence. And that is why, to me, the total calories you are consuming in the day is very important, regardless of what kind of diet they come from. Now, keto diet is a more of a high protein and a high fat diet. Some of the important points about the diet is that we know that protein stays longer in your stomach and takes longer to digest. That's why it makes you feel fuller more, and you may not feel very hungry, as opposed to if you were eating like a simple carb food or more starchy food. It's also a high fat diet, the keto diet. So people who have really followed that diet, point on, we have seen that their cholesterol levels were many times at the higher side of normal. In fact, higher side, abnormally high, I'm sorry. So we need to really be mindful of these things. Intermittent fasting is like a diet where you are maintaining a fast for almost 16 hours, and then there is that 8-hour window frame where you are allowed to eat. Now,
Right.
This diet doesn't really specify how much you can eat and what you can eat. They say that you can pretty much eat anything. So in my mind, in that 8-hour period where you're allowed to eat, if you eat like a whole large pizza with a Coke, I mean, you're done. You're more than done for the day.
Right.
You have to outrun your calories. So I don't know. I think that is why at the end of the day, it's so important to know how much you're eating in a 24-hour period. The other point is that are these diets really sustainable? I mean, for example, a keto diet, how much protein can you eat? How much fat can you eat? You can't follow that lifelong. Like, you can't just keep eating chicken and, and fish and the red meat and, paneer. A lot of Indian people, we eat paneer and cheese. I mean, we just can't keep eating that. It's not always palatable. So sustainability is also an issue with these diets. So I would like to emphasize that the number of calories you're consuming is very important.
All right. So, I mean, to boil it down, again, you're going back to the previous question that, I mean, whatever diet you're following, I mean, you should be, again, mindful about how many calories you're consuming, right? I mean, if you can clarify more.
100%. And that I want to say to the viewers that do not get swayed away by a keto diet or an intermittent fasting or a Mediterranean diet, because there is mixed evidence on this. We do not have conclusive evidence that these really work.
So, Dr. Yashi, just wanted to ask, does that mean that you follow your calling because you are, now you're mindful of how many calories you're consuming, or is there any way that you can figure out that this is the set kind of diet which I'm going to follow by following the needs of my body? How does that work?
Right. So the most success that I have seen, Sharat, is in patients who are able to eat things that they cook every day.
Right.
Or is their food that comes because of their ethnicity, or if it's the Indian kind of cuisine that they enjoy, or an Asian cuisine, or something along those lines. However, we need to be mindful of how much you're eating, right, and what you're eating. For example, if it's a diabetic, obviously they should be cutting back on the carbs a little bit, the sugars a little bit, right? If it's a patient who has high blood pressure issues or heart failure issues, they need to be cognizant about the salt content there in their diet. I mean, they can be sprinkling extra salt in their salads and so forth. So those are the things we need to be mindful of. But I have seen most success with patients when they are able to eat their usual diet, but just having that knowledge in mind of how, frequently or how much they can eat.
I just wanted to ask you, how can people keep themselves in check about, how much they're eating and, what they're eating, and how do they keep a track of these things about diet?
Right. So one way is people who are tech savvy and are used to using their mobile phones, they can download a lot of apps that can help calorie count. I gave an example, of MyFitnessPal. Similar apps are there, even on the iPhone. There are a lot of apps that help calorie count. So they need to really start jotting down what they eat. Whatever they had for breakfast, whatever they have for lunch, for snacks, and then for dinner. So that way it will give them the total amount of calories they ate at the end of the day. For people who do not want to do this on their phones, the alternative method is that they simply write it down on a piece of paper, or in a diary. It's very simple. If you want to Google how much calorie is in a boiled egg, just literally write that on your Google. It's just going to show the number of calories. So you can just find those answers out from Google and pen them down. And that would be another way to just jot down your calories. It seems cumbersome in the beginning that you're having to literally look up the calorie for each food item. But I promise, and I have done this, I promise that once you have done this for a week and it becomes like habitual, it's so quick. You'll remember. It comes like really quick in your mind that, oh, I had like a toast, it's this much calories. I had a peanut butter sandwich, it's this much calories. I had a sunny side up egg, it's this much calories. It comes really quickly. You just have to do it for a week, 10 days. But I can't stress enough how important it is to have this knowledge about calorie counting.
The way you said, using the apps to count your calories till it seeps into you and it becomes second nature, so that you don't lose track of how much you're eating and things, and facing any repercussions or complications, and just a little bit more about that.
Right, exactly. That's exactly the point that I wanted to make, Sharad. The other thing is that it's important to know how your plate is made and how much you are eating of that food. So maybe eating like, 3 main meals and 2 snacks a day is the way to go. Um, in the main meals, if you look at your plate, it should probably be consistent of half the plate vegetables and fruits, 1/4 whole grains, and the other 1/4 as lean proteins. And let's not forget our water, as well as the little bit of oil that we all use, that that goes in our food. But as you can see, this image of the healthy eating plate, that's the kind of plate we are looking for in our main meals. Another interesting point I want to say is that over the course of years, our dinner plate sizes have increased a lot. People
Right.
always like to have more and bigger things. So the plate size has really increased. And, because the plate is increased, you don't like empty spaces. And we tend to fill in a lot of food there. And that is why we end up consuming a lot more. So the suggestion I want to make for that is maybe consider eating on a side plate or a quarter plate where you can fill in less food. And please, obviously, we do not make heaps of food there, but the point is to have less quantity of food. And drinking 8 glasses of water, around 65 ounces, is just so important as well. Sharad, that's all really important. But I want to say another concept for our viewers about calorie density. So what is the calorie density, or what are calorie dense foods? The first point I want to make is that we should be attempting to eat low calorie dense foods. Okay, so low calorie dense foods are foods that are high in protein and fiber but low in calories. So these foods can then help you keep fuller because of the higher protein content and the fiber, and help you lose weight. So for example, you are calorie counting and you have about 100 200 calories left in your day that you can eat to make up for the total number of calories that you have to consume, and you're very hungry. So what would you eat? Would you rather choose an apple, or would you rather eat peanut butter? So the answer is the apple, of course, because one apple is 100 calories, but 1 tablespoon of peanut butter is also 100 calories. So peanut
Right.
butter is very calorie dense food. So you should be avoiding that, because you're not going to feel fuller in eating 1 tablespoon of peanut butter, but you will feel very full in eating that apple. So eating, more of apples and fruits, nuts, those are a little bit more low calorie dense foods that we should be aiming for. So that's another tip that I wanted to give to our viewers.
Thank you. That means that, the right choice boils down to the right choice of foods as well, even though they are the same calories. Which one is more healthy is what you choose. So, so I hope our audience are, jotting their notes and, imbibing all the wonderful tips and tricks you're giving them. So I'll jump to my next question. Tell us, your take and your thoughts on meal replacements.
Yeah, so Sharad, there is data to suggest that meal replacements help us lose weight. However, the problem with the meal replacement is the consistency to continue to use the meal replacement for a long term. Meal replacements are basically bars or shakes which can help you lose weight and are usually more in proteins. as opposed to other macronutrients, because they help you keep fuller. However, in my practice, I have seen that they are not the most palatable, and having to use them every day has been the problem for a lot of people. But if people want to use meal replacement, I would suggest to ideally go to their practitioner and have those meal replacements prescribed, because the prescribed meal replacements have the right amount of macro and micronutrients that we need, as opposed to a store-bought one, because there's so many store-bought meal replacement that are out there. People just buy and use it, but I can't really speak for their micronutrient and nutritional content. But if people were to use the meal replacement to lose weight, we need to replace 2 of our main meals with a meal replacement. And to maintain your current weight, we should be replacing 1 of our meals with the meal replacement.
Thank you so much. So does that also take into consideration supplements as well? When you I've seen in the maybe in CVS or Walgreens or these pharmacies or per se any supermarket too, that there are supplements for regular foods as well. What is your take on that?
Right. So the word has been used synonymously, supplements and meal replacements. And
Right.
These are the store ones that you're talking about. You can use them, but medically they have not been, studied that they have the right amount of micronutrients or macronutrients that we need to for adequate functionality of the body. So it's okay to do it for some time, but long term, I don't know how advisable that is. Therefore, I was suggesting that have it medically prescribed. But yes, those are the meal replacements that you are mentioning that people can sometimes use for a short duration.
Thank you, Dr. Yashi. Now that we have come this far, how to track your calories, choosing different diets, weighing which diet is good, and actually becoming proactive about your diet and losing weight, becoming more mindful of what you're consuming on a daily basis. Can you tell us, how fast can you lose weight if you're following the right diet, and is there any right diet?
Yeah, so it's very important to know how much weight you should be losing every week, because there are a few people who want to lose a lot of weight very fast, and that's not a healthy weight loss. So, Sharad, medically, a good amount of weight that one should be losing, with the right diet and physical activity is 1 to 2 pounds per week, or 0.5 to 1 kilos per week, and not more than that. And that is the right way to do it.
Thank you so much for your valuable tips, Dr. Yashi. I'm very sure the audience are enjoying this session thoroughly, and as I said, benefiting big time, and especially this topic of diet, favorite of everybody. A lot of misconceptions and conjectures are around diet, and because of that, we go berserk and choose the wrong diets per se. But having said that, with your wonderful answers, with your guidelines, I'm very sure our audience and anyone who's watching this show will be benefited at large. So we're almost at the end of the session. So I want to ask, I just wanted to acknowledge this. So any final advice to our MANATVINT international audience on how to start a healthy diet and how much calories they need to consume while they're eating to maintain the perfect BMI, maintain their weight or lose weight per se, and to calculate that, just if you can recap a bit or give more of perspective about what I asked.
Right, Sharat. So I'm going to summarize some of the important points that we made during this episode. So I'd like to tell our viewers, if they are to start looking at their diet and pursue something towards that direction, first step is to start by knowing how many calories you are actually consuming in a day right now. That you can actually find out by plugging in your current height and weight and your activity level on an app that's there available freely, widely on the internet. Once you know how many calories you're consuming in a day, then try to hit for a 500 calorie deficit. That's when you will start to really lose weight and engage in some sort of physical activity, stay active, eat the right kind of diet, wholesome diet, drink lots of water. That's very important. The next thing I'd like to say is, once you are following this, check your weight every week, first thing in the morning, with minimal clothing. Because once you know what your weight is this week, you know what steps you can take this week to make it better the next week. So you know you can track your weight chart. So it's important to know your weight as well and how it's trending. Okay, so that's the next thing I'd like to say. And the last thing I'd like to say is that there is data to suggest that try to get your groceries in the morning. Make a list and go buy your groceries in the morning, because you usually tend to make healthier options. You usually tend to pick healthier food options from the shelves, as opposed to when you go for grocery shopping at night when you're tired and you want to grab onto something very unhealthy, like a bag of chips or Coke or something. So try to get your groceries like early in the morning. Not only do you get a better produce at that time, you tend to make healthier choices as well. And try sticking to eating more seasonal fruits and vegetables, as opposed to not eating any or just trying to eat organic. Just eat any fruits and vegetables, and seasonal is better.
So friends, that was Dr. Yashi with her brilliant tips and tricks and her lovely guidelines about diet. The most coveted and awaited topic for all of you guys. I know that you shooted a lot of questions, and here she is answering beautifully about diet. I've learned a lot myself. I'm very sure you guys have taken all the notes and imbibed the right ones, and you're going to implement them in your daily life, and you're going to spread these messages to everybody who are in need, and definitely who are facing problems with obesity in regard to diet as well. We have cleared a lot of air. So that was Dr. Yashi's session today, and that was Dr. Yashi's take on diet. And we're going to be back yet again on our 8th series called Obesity Care with Dr. Kanica Yashi on MANATV International. And don't forget to subscribe to our YouTube channel, MANATV, and our Facebook page, MANATV, and also watch our live streaming on YUPP TV. Thank you.